Okay, and we're off. So we're going to talk about gearing up for Medicare open enrollment. This is our second half of it. We started in September. The materials are the PowerPoint presentation and the workbook, and both are posted online, I believe. But as I mentioned earlier, I'll send out the presentation to everyone in attendance today as a PDF. If you would like a PowerPoint copy, please feel free to email me and I can send you the PowerPoint as well. I know some people like that because they print them and then they can do 2 or 3 slides on a piece of paper. Our learning our outcomes we're hoping that you'll have a clear understanding of the Medicare changes for 2026. You'll enhance your skills in using the new knowledge and relevant tools and improved communication strategies for effectively counseling Medicare beneficiaries. Our scenario today is it's it's doing coaching of people who can self-help a little bit, who can use computers, because we are expecting, and I have actually been receiving more clients because of the Jumpstart toolkits that they can self-help. They use Medicare.gov and they can be on a computer or on a device while we're talking to them. So that's our focus today. And we know that many of the people that you help doesn't apply to, but we thought that that's kind of a gap. So that's what we're trying to cover, is talking someone through helping themselves. First of all, we're going to talk about some of the changes, the Medicare Plan Finder 2026 updates. There's an inclusion of the Medicare Advantage provider directory, and that has information on providers in that you can add providers to the Medicare Plan Finder, and it will tell you whether they are providers that are listed for plans. Now, here's the thing, is this is a work in progress. Okay, the providers that are in there, it's not the complete list. They said that they would be um, adding providers to these lists until the beginning of November. Okay, and it will be updated and changed as it goes on, but it is there. So we were in there last week, and for example, we saw some providers that weren't listed on Tuesday when this provider list was added, the function was added, and then on Wednesday they were there. And we'll look at that after again, as I said, if you'd like to stay for that. There's an expanded display of Medicare Advantage supplemental benefits in the details pages. There's a few more things added or a little bit more information. And then there's an AI-powered drug search tool. I haven't seen that, but I've heard a couple of people who said that they saw that on accounts. I looked on my mom's account last Friday and it wasn't there yet. That you have to be in a Medicare.gov account. We were in one yesterday and it wasn't showing it. But then again, the plan finder crashed while we were in that account looking at it, so that could have been part of the issue. But there is that new Medicare AI-powered drug search tool. Unfortunately, I can't tell you what that is, what that looks like, because we haven't seen it yet. Hopefully it'll be there soon if it's consistently, if it hasn't been. There's the Medicare provider directory and supplemental benefits. It shows the participating providers. If a plan's provider data is not available through the new system, the Medicare Plan Finder will link to the plan's own directory. We were seeing this with the Providence plans last week, that none of them had the provider directory information. So it was just linking to the website. Okay. For the supplemental benefits, it's just greater clarity on the plans that are the benefits that are available. There is a temporary special enrollment period if a beneficiary makes a Medicare Advantage choice based on inaccurate or misleading information. They may qualify for the SEP. Okay, the SEP, the special enrollment, is available for 3 months after the effective date of the MA plan election. Okay, so for our people who are joining plans now that will start January 1st, this SEP will also be available to them. Okay, and in addition to the Medicare Advantage open enrollment period when they could make a change. But let's say someone joins a plan in January. Okay, let's say they use their Medicare Advantage open enrollment period to make a change to another plan, and they base their change on that plan based on information on the plan finder that their provider would be in network. They can get this SEP for their plan that starts February 1st. They would get it for February, March, April. Someone new to Medicare who's starting in February, who's enrolling in February in a plan that's going to start in March, okay? They're going to start their plan March 1st. If they're making that choice based on the provider information on the plan finder, they'd get this set for March, April, and May. Okay? They're saying it's temporary. We don't know how long they'll run it, but that's what's the way it's going to work for now. Individuals using the special enrollment period will be able to do get switched to a new Medicare Advantage plan, or they'll be able to disenroll from Medicare Advantage plan and return to original Medicare. Monica.
I'm assuming the beneficiary needs to contact Medicare in order to do that, correct?
Yes, these SEPs are issued by Medicare, because what they're going to do is they are going to look up the account and verify that that person enrolled through the plan finder. Okay, and that the plan was listing providers. So these are Medicare issued special enrollment periods. There's not going to be a checkbox that we can just say that they did that. It's going to be verified by Medicare and issued by Medicare. Okay. And they just contact 1-800-Medicare. Okay. They could also contact their plan. Their plan can get the authorization, but the authorization is issued by Medicare. Okay. So let's just have a little bit of Rachel.
I just want to make sure this is clear. So if somebody comes in on a Medicare Advantage plan, then they're guaranteed issue into Medicare and a supplement and a Part D because that plan is not covered here anymore, that they have to call Medicare, or just doing on the plan is going to be okay.
No, this is a little bit different. This is when, so what you're talking about is when a special enrollment, when a plan is ending or terminating, that's when they get that guaranteed issue. The Medicare Plan Finder has a new function where you can enter providers into it, and then it will show whether those providers are in network for the plan. You can also list must-have providers, like I must have this provider, and so that it ranks the plans by those providers, okay?
Yeah,
And
I found that yesterday with that, but yeah, so I'm straight. I got you. Thank you.
and so that special enrollment only applies to those plans and using that provider list. That's what that special enrollment period is. We'll talk a little bit about, we can talk a little bit more about the plans leaving in just a little while. What factors do you prioritize when you're counseling someone about their MA plan options? Let's have just a little discussion. Does anyone want to kind of share what they prioritize when they're helping people with Medicare Advantage plans during open enrollment?
Well, first and foremost is the formulary and what medications they might be on.
Yep, and that's where we start with the plan finder, right? I mean, that's what the plan finder is kind of basing everything on, is their medication list and the pharmacies that they want to use. Are those covered? And then the providers, anyone else?
This is Hope from Clark County, and I prioritize based on what the client wants.
Yeah.
I mean, do they want their provider primary care, or do they have a specialist, or is it their drugs? It's whatever the client prioritizes in my mind.
Yeah. One of the kind of challenges with that, right, is sometimes our clients think that they want dental coverage the most, or they want their gym membership the most, and not like they don't know what they don't know. And I agree with you, Hope. I do the same thing. I try to really listen to them and prioritize, but it's also important that we share, okay, but if there's a doctor that's important to you to have, we want to make sure that they're in network, because you won't be able to see them if you or you'd have to, you wouldn't have coverage to see that doctor, things like that. And I'm guessing that's what you meant too, but Prakash and Aruna.
Yes, I try to find out why they want to change their current plan if it was still being offered. That
Okay.
gives me some clues as to what are their priorities as far as the coverage is concerned.
Excellent. Yes, right. If they have a problem with something, it's good to know that we can try to help them with a plan that will resolve that problem, or at least diminish it a little bit. All right. Anyone else want to share anything? Okay. I try to make sure I always do income screenings, right? Because a lot of people might be eligible for DSNP plans. They might be eligible for MSPs and not have them, especially people who are older, that they've been on Medicare for a little while. If they had some savings, they might be eligible for those MSPs and not have one. So I try to make sure I do that. Okay. The AI-powered drug search tool, it's for authenticated users. And like I said, I'll be honest with you, I haven't seen this because you have to be logged into an account. Has anyone seen this? And I tried it with my mom's last Friday, and I was told by someone else that they saw it happen on Monday in a conversation. They said they saw it happen, but I haven't seen it yet. But it does personalized cost comparisons. And so from the sounds of it, what it does is a lot like what we do anyway, that we tend to look at the costs and it's like, okay, you can get your atorvastatin. You could get everything at your current drugstore, and your atorvastatin is going to be, $5 a month. It's going to be $60 for the year. And that's not a good example because it's usually zero, but it'd be zero mail order. So if you wanted to save some money, you could get this at this pharmacy, right? Or this at this pharmacy. It's that same sort of thing where it's kind of showing the cherry picking that sometimes we show to clients who are interested in just in saving money in that way, that they're willing and able to use multiple pharmacies. All right. Anyway, that's something to keep your eyes out for, is that it will be there. There's some DSNP changes in 2026. And the end of zero co-payments for prescriptions. That doesn't mean that there won't be any zero co-payment drugs, okay? What it does mean is that we're seeing that most of the plans are charging co-payments for some of the medications, at least the brand names, where before they were absorbing all that cost and people weren't having to make their $12 copay for their Eliquis. Now they're making those copays, but we still have the atorvastatin and the lisinopril and those things that would be zero on any drug plan. There's still zero on the DSNPs for the most part, things like that. But we're seeing that people are having some co-payments on the DSNPs, which we didn't see in most of them because they didn't they weren't having the clients pay those. That was one of the benefits of DSNPs. We also have new eligibility requirements for supplemental benefits. So, I'm just going to give you an example on this new eligibility requirements thing. Is I have a friend with special needs that I help her with her Medicare, and she's had the United Healthcare DSNP. Okay. And I think she was getting $124 a month last year on her Flex card. And the first thing when she got her ANOC, she's really good at opening things and taking pictures of them and sending them to me. But when she got her ANOC, she noticed right away. She's like, and she texted me, I'm only getting $88 for my benefit, my over the counter. And then the other $44 is based on chronic condition. Will I get that? And the answer is that the plan makes those determinations on whether someone gets it. There is criteria for that, but they have to meet certain qualifications to qualify for the extra amount for chronic condition. And that includes some of the things like the pest control and things like that. There's just some special conditions that people have to qualify for that chronic condition funds. Prakash and Aruna.
Yeah.
Noreen, so since this value-based, insurance program is ending, VBID is ending for DSNP, do we know how much is the copay for something like Eliquis or anything of that sort?
Well,
for a
it's good.
person?
Yeah, it shows on the plan finder, Aruna, and all of these people have extra help. So their maximum is going to be the extra help maximum for next year. This year it was $12.10, I believe. I'm not sure what it is for next year yet. But it would be whatever the maximum is, that monthly maximum amount.
Oh, monthly, okay, for any drug?
Well, it's for it's for each fill.
For each.
Oh, for each drug, okay.
Right, and for each fill of a drug. Yeah.
So then, at least the people who were getting totally free will not be able to get it. But say if they have 5 prescriptions and each drug has maximum of $12, it'll be say $60 a month.
It could be, yeah.
Oh,
It could be less though. That depends on the plan. And the plan finder will tell us that. Or or the plan can tell them that. They can call the company for the prices. Okay, this is an important thing to talk about, the 2026 reassignment of LIS beneficiaries. In October, CMS is going to reassign people that have extra help. They might be reassigning them into new drug plans. If their current plan is no longer going to be available at the LIS premium limit. So if their plan increased its price over the premium limit, which means a person with LIS, they might get the first $40 of a premium paid. Okay. If the price was under $40, so the premium was paid, and now it's at $46, the person would have to pay that $6 difference. Okay. If that's the case for a person with extra help, they're going to change those people to a different plan that would be zero. Okay. If their current PDP is ending, they're going to get reassigned. And then if they're in a Medicare Advantage plan with drug coverage, that will end or reduce its service area. So if the Medicare Advantage plan is ending, or they're decreasing their service area, so that person no longer has drug coverage in that county. Like if it covered Garfield County and it no longer does, right? Then that person would get reassigned if they had extra help. Now there's some people who this doesn't apply to, okay? And that's people who chose their drug coverage last year. Those are called choosers. But the first thing to know is these people who are getting reassigned, they're going to be they're all people who were automatically enrolled or reassigned last year. Okay, meaning that they didn't make their own choice in 2025. Anyone who made their own choice wouldn't get reassigned. If they're still eligible for extra help in 2026, they must still be eligible in order for this to happen. Those people are going to get a blue letter in mid-November. Okay. They're going to get 2 blue letters. So one of the ways that we can tell if a person falls into this category is that did you get a blue letter or a tan letter? There's 2 different letters that people are going to get. And I will get to the question in the room, but I want to get through these next few slides first, okay? Because we might have the answers for whatever you're going to ask. But the blue letters, there's 2 blue letters that people are getting. The first tells which new plan they're being moved to. It's going to show the 2026 premium cost for their current plan. So if their plan is one of those that the price increased, it's showing the premium cost for their current plan, and explains that if they want to stay on their current plan and it's still offered, they must contact the plan to stay on the plan. Okay. In other words, if that plan that I explained, like having that $6 premium that they would have to pay, they must contact that plan to stay on it if they were auto assigned into that plan and they fall into this category. Then later in November, there's going to be a second blue notice. It's going to show which of their current prescriptions are covered by the plan that they've been assigned to. And it's going to explain how to request an exception, appeal, or file a grievance. Okay, so they'll get 2 blue notices from Social Security. They're also going to get information from the plan that they're being enrolled in. So they're going to get an enrollment confirmation and enrollment materials, just like anyone else would through the plan, like through the enrollment that they do, right? The current plan that they have that's going to end on December 31st, they should have gotten an ANOC already, right? That should have come out by September 30th. And it would have said that the plan is ending or the premium is increasing, and it's going to send a disenrollment confirmation to the people who are being reassigned. Okay, so they're going to get a lot of communication on this. There's also people who are not being reassigned. Those are choosers. They're people who had extra help and picked their drug plan in 2025. So if we helped a client pick a drug plan in 2025, that had extra help and they're still eligible for it next year, and their plan is ending or increasing, they either need to pick a new plan themselves or they're going to have to pay that extra premium. Okay? Is everyone following it? Those people are going to get a TAN letter. And the TAN letter is going to tell them that their monthly premium will increase, or they will have to start paying the extra premium if they don't change. Okay? So that letter is also going to list other plans in their area that are available with no monthly premium. So it lists that there are other plans available. Okay. So if they have the non-renewal, it's any prescription drug plan that is not renewing and any MAPD plan that's not renewing or reducing their service area. Okay, they're going to get the blue letters. Okay. Remember that people who are losing their plans get a special enrollment period, and people with extra help have the same rights as people who are losing their plans. Okay, so if they also have extra help, that if they're like, if you had a person who was on a Medicare Advantage plan that was ending, that was terminating, right? And they had that extra help, they would get put onto original Medicare on January 1st and get auto-enrolled. They would be auto-enrolled into a Part D plan. Is everyone following me? Because Medicare doesn't reassign people to Medicare Advantage plans. They would put that person who's losing their Medicare Advantage plan that has extra help, that follows into the blue letter category, right? They'd put them onto original Medicare and a Part D plan. They'd auto assign them onto a Part D plan. That person still has the right, if they figure this out in December after open enrollment has closed, they could still make a change to a Medicare Advantage plan because they have a special enrollment period, just like everyone else, that's going to start on December 7th and goes through the end of February. So they could make that change for December, they could make that change in December for January 1st and still have a Medicare Advantage plan. Okay. They'd also have as a Part D person on extra help, they'd have special enrollment periods that they can use to change their Part D coverage if they needed to. Prakash and Aruna.
Yeah, the question I had was if the people on extra help, their MA plan is ending and Medicare assigns them to original Medicare and Part D, can they have a guarantee issue for Medigap plan?
No.
No. So if you are on extra help, there is no guarantee issue for Medigap?
No. Nope. Monica, did we have a question in the room? And I keep saying Monica because your name's on the screen. Or did we answer it?
Nope, you answered it. That was my question on the Medicare Advantage plan, if they get put back on a standalone Part D. That was my question, not assuming that they're going to get on a Medicare Advantage plan again, that they change them back to original Medicare.
Yep. And they have that special enrollment period that they get until the end of February because they lost their plan. Okay, because everyone who loses their plan has a special enrollment period that starts December 7th and goes through the end of February.
So Noreen, then if they lost their plan and their plan's no longer being serviced,
Yeah.
and those on extra help, why do they not get a choice to purchase a supplement if they want to?
Well, I was just thinking about that because they would, if they get the letter from their plan saying they're eligible, then yes, they'd be eligible. Because they have that special enrollment period that everyone gets for losing their plan, right? They don't lose any of the benefits anyone else with Medicare gets. They just get more benefits with extra help. Or any of the privileges, right? Like that extra. So yes, if their plan was leaving and there wasn't a comparable plan, right? And they would get a they would get a guaranteed issue because their plan is terminating, then yes, they would have that guaranteed issue for that reason, because the plan is terminating, not because they have extra help. Clear as mud? Precautionary Runa,
Yeah.
I'm going to ask you to write down your question
Okay.
and we'll do it at the end
That's
because I
fine.
want to I need to make sure that we get through information and I really want to
Yeah.
go into the plan finder to look at that provider information. Okay.
That's
Thank you.
great.
Thank you. All right. So the Medicare star ratings, and what they mean, we're seeing more star ratings this year. And as we have kind of more similarities, it's a kind of a good thing to consider. They measure the quality of the Medicare Advantage plan and the prescription drug plans. They're based on a broad set of performance measures, including clinical outcomes like managing chronic conditions, member experience surveys, customer service, and drug safety and pricing accuracy. So that pricing accuracy on that's offered, that's taken into consideration in the star ratings. And they're published annually, early October, by the Centers for Medicare and Medicaid Services, or, Medicare, CMS. Okay, so that's something to take into consideration when we're looking at plans too. And data is collected from plan reports, Medicare surveys, and healthcare providers. So they're trying to make those more robust. And on the plan finder, you can actually expand out those Medicare star ratings and see how they apply to different categories. If you'd like to review those with your clients, that can be helpful. I find those a little bit more helpful with Medicare Advantage plans than the drug plans. I don't know about anyone else, but all right. So we have a poll that we're going to launch. Asking what your experience is with using the plan finder for the updated information. Let me try to get to that. Whether you've been on the plan finder this year yet. Okay, and is that showing? Yes, good. All right. I think give it another minute or so. Actually, about 40 seconds. That'll be 2 minutes total. Okay. So it looks like we have about a fourth of you haven't been on yet. And then some people have been on, like, basically looking at their stuff personally, and then about half of you have been on it. So good. Okay. Moving onward. Sure. Okay. So Prakash and Aruna, I can take your question now. We're okay for time.
I think I forgot my
Oh,
question.
I remember it.
Oh, Aruna
Uh,
remembers.
You were mentioning about people on extra help. If their plan is ending, then they will be automatically put on original Medicare. And when I asked a question if they'll be eligible for the guaranteed issue, you said first time no, but then when you were answering Monica's question about
Right.
on the same topic, you said yes. So we are confused. Which way is it going?
I rethought that, Aruna, because when you were asking your question, I was thinking of would they get it for because of this auto assignment? Would they get if they were on Medicare Advantage and they got automatically assigned to them to the drug plan, would they get that? And they wouldn't get it for that reason, but they would get a guaranteed issue because their plan is ending.
But they will have
Just
to
like
pay their.
just like everyone else. When your
Okay.
plan terminates and you're on a Medicare Advantage plan, you get a guaranteed issue on a Medigap if it meets certain criteria, right? If there's not a replacement for that, then people get a guaranteed issue. Anyone on Medicare would get that
Okay.
if their plan meets the criteria. So their letter from that about their plan termination, their ANOC, their annual notice of change that they got in September would tell them that they have that guaranteed issue.
Okay.
Oh, okay.
And then if they are on extra help, the government only pays for their Part B premium, but they will have to pay their Medigap plans premium themselves, right?
That's correct. That's
Okay.
correct. Yeah. And so most people on extra help don't get supplement plans. They don't get Medigaps because they can't afford them, right?
That's right.
Okay.
So, all right.
Good. Thank you.
Yep, I'm going to move
Is
on.
there any question?
So we have a counseling session. And I know it works because I got stuck on it before, but we have a video. And this is a session where we have a person coming in or we have a person on the phone, and we switched it. I'll be honest with you. We started with doing this live, and then we kind of switched it to a phone call at the last minute and forgot some of the other nuances might get sticky. So I want you to imagine that the client that they're talking to uses a device. Okay, she uses a tablet or something that she knows how to get onto Medicare.gov, and she might be following along a little bit, although it's a little fast for that, but that person would be, capable of following along like that. Okay, this is more about kind of coaching someone who can self-serve. And I'm gonna reshare with sound. Hmm. Okay. Remember that sign I said I wanted? We're experiencing technical difficulties. Please stand by. This would be one of those times when we'd be using that. Because this worked when I tried it earlier, and now I can't get it to work. Let's see if it's back here.
Narine, you can also use that link maybe to access it.
That's what I'm trying to do, yeah.
Yeah. Or I can give you a
I
link
have
if you
it.
need.
No,
Thank
it was just hidden.
Okay, great.
Yep, we have it. It was just hidden behind another screen. Because I'm recording, it has to be as embarrassing as possible on a recording, right?
Yeah,
All right.
that would be the case.
All right, here we go.
You've got it.
Hi, Frankie. My name's Mamie. I'm a SHIBA counselor. We help people with Medicare. And you had called for some help. What can I do for you?
Hi, Mamie. Thanks for calling me back. So I had reached out because I got a letter that says that my WellCare PPO plan is leaving at the end of the year. So it said I could call you guys to see if I could get some help or make an appointment.
Okay, sure. And we could actually do a review right now if you have time. It takes about 45 minutes to an hour. Do you have time to do that now?
Well, I only have about 10 minutes, so I'm not
Okay,
sure if I should make an appointment or.
sure. So, do you feel comfortable using like a computer to do research and look up information?
Yes, I do. I'm comfortable with that.
Okay, and have you done that with Medicare, with your Medicare at all? Use the Medicare.gov site or the Medicare Plan Finder?
No, I haven't.
Okay, well, the Medicare has tools that you can use. And if you're comfortable doing research and looking up things yourself, you might like to try this. And then if you want an appointment, we can schedule one for you by all means. But this might be a little bit faster and easier for you if it's something you're very comfortable doing. Would you like me to show you like some of the things to look for?
Yes, that would be great.
Okay, so we're going to go on to Medicare.gov, and that's the Medicare website. And it's where we find the Medicare Plan Finder, and it's simply Medicare.gov. And we get a home screen, and on that home screen, you'll find a few different places where it's going to say Find Plans. You can also sign into an account. If you make your own Medicare.gov account, then it will save your information, and you can do the comparison anywhere on the Medicare.gov site or from your account that says Find Plans. Okay, so that takes us into what's called the Medicare Plan Finder. And it says, and on that page, it'll say explore your Medicare coverage options. So this is pretty user friendly. Okay, it's pretty clear what you're doing when you go onto these pages. And we're going to be looking for plans for 2026 because you have your plan through 2025. And it's going to show you all the choices that are available to you based on your zip code. So what is your zip code? That's our starting point.
My zip code is 99203.
Okay, thank you. And then you said you had a WellCare PPO plan
Yes, that's right.
that you're losing? Okay, so that's a Medicare Advantage plan. Are you comfortable with the Medicare Advantage plans with having to use networks and things like that?
Yes, it has worked pretty well so far. So I like
Okay,
it.
and then your plan that your plan that you had was a PPO. That means that you can see out-of-network providers. It's great if you travel or things like that, or if you think you might need to see specialists, in another location. But do you have that where you travel a lot, where you might need medical care, like in Arizona for the winter or something like that, or that you might need to go see specialists out of the area?
No, I don't really travel much. So
Okay. Okay, so an HMO might be okay for you too. We'll certainly it's going to look at everything that's available. It's just kind of nice to know if someone has those needs, particularly for a PPO. So what I'm doing, I'm choosing it. The Plan Finder asked me to choose what kind of plan I want to look at. So we're going to look at Medicare Advantage plans, rather than original Medicare Part D coverage, since you like those Medicare Advantage plans. And then, do you have income that's over about $2,000?
yes, I do.
Okay. So you don't currently get any prescription drug assistance or things like that?
That's right. I don't.
Okay. So do you have prescriptions that we want to look at when we're comparing plans? Because a lot of it is based on the cost of your prescriptions for you with the plan coverage.
I do. I do have some prescriptions. I take a few generics, but I'm not too worried about those. I'm mainly just worried about the two more expensive ones that I take, which are Jardiance and Eliquis.
Oh, those are expensive ones, aren't they? Okay, let's start with
They
the
are.
Eliquis. So the Eliquis, is that 5 milligrams twice a day?
Yes, it is.
Okay. And Jardiance, you said?
Yes.
And what's your dosage on that? Is it 25 milligrams or 10 milligrams?
It would be 10 milligrams.
Okay. Do you get those filled monthly or do you get multiple months?
Monthly.
Okay. And you take one Jardiance a day, right?
Yes.
Yeah, that's common. Sorry. All right. And that's it. That's all we're really worried about looking at?
Yes.
Okay. Okay. So we need to pick some pharmacies. What pharmacy do you like to use?
Well, I live close to a Costco, so I go there often. So Costco is an option. But then Safeway is pretty close as well. So I could go there if Costco doesn't work.
Okay. Is it the Safeway on 29?
Yes.
Okay. And if it was going to get you lower costs, would you be interested maybe in going to like the Rose Hours that's across the street to get your
Oh, yes.
pharmacies, to get your
Yes.
prescriptions? Okay.
That would be fine.
Great. So we'll start by looking at Costco, Safeway, and Rose Hours plus mail order is what I'm putting in there, just so we have an idea what mail order might be for you. Because sometimes it can save people a lot of money. Sometimes it doesn't. So are you interested in Kaiser plans at all?
No, I had Kaiser before, and it didn't really work well for me. So no, I had Humana before. Is that an option? I really like
Sure.
them. They
Yeah.
seem to work well. So I would be happy going back to Humana if that's an option.
Okay, and yeah, Humana actually has two plans that are coming up as the lowest cost options when we sort these. There's a Kaiser plan that's first, and then there's two Humana plans. One is called the Give Back plan, the Humana Gold plus Give Back, and the next one is the Humana Gold plus plan. And they're both Humana plans. And when you're looking at this plan finder, you're going to get a list. It's called a summary page that has the plan sorted by cost for the premiums plus your drug cost at the pharmacy. And so both of those are coming up as good options. And then you have an option on each of them to compare them side by side. It's a little box that you check down by the details that says add to compare. And you can do that and compare them. And then we have a side-by-side view of them, and you get to see all the costs and the differences. So on these two plans, just really quickly, as you're looking at it, you're going to see that the give back, that means that it has a Part B premium deduction, meaning the money that is taken out of your Social Security, they'll take, in this case, $66 less for it. But you want to look at the other costs because there's other costs that are more. Like on the plan that has the $66 reduction, meaning you get $66 more, you're saving $66 a month on your Part B premium. It has a health deductible of $500. So you're going to have to pay the first $500 for your health care out of pocket. Where the other plan is also a zero premium plan, no cost per month, but it has no health deductible. So you can see how you have kind of six of one, half dozen of the other on these. And so it all comes down to what you want for your coverage and for your options. So you can do the comparison from the summary. You can do the little box that says add to compare and do them side by side. And then from those side by side, you can go into the plan details for each plan. Do you think that's something that you'd be able to kind of do and look at? It sounds like you're pretty familiar with your insurance.
Yes, I think I can manage that. So I just go to the plan details from once it gives me the options, and it should break it down for me, right?
Yes. And the side-by-side comparison gives you a lot of comparison side by side in general. And then you can go to the details of each plan to see how they work out for that specific plan. Like the Gold Plus also, I believe, has like maybe different dental benefits and things like that. And it does have an over-the-counter benefit where the give back, the plan that has that $66 back in your Part B each month does not have an over-the-counter benefit that if you use it, that could weigh in as a factor as well. Your drug costs are basically the same with both of them. So that's going to be, that's going to be a wash there, but you can kind of look at what will wash out and what is the differences and what, based on what's important to you. And I want to let you know after you've done that, if you would like, you can either call Humana and ask them any questions about details. And the number for Humana is on the top of each detail page to call them. Okay. Or you can give us a call back and we can do an appointment for you and go over this with you if you're more comfortable doing that. And if you're comfortable doing it over the phone, you can be on your computer looking at it and we can talk you through that on the phone too. In there at the same time looking at things. Okay. So you have lots of options, but you can start with kind of looking through and seeing what your options are that you're comfortable with. You always want to check with your doctors to make sure the offices, and you want to talk to the billing office or look at your provider's websites. They sometimes have lists of what Medicare Advantage plans that they're accepting for the next year to make sure that they are in network, because even if they were in network a few years ago, they may have left the network. So you want to check that. Okay.
Oh, yes. Thank you for that. I'll make a note of that so I don't forget.
Okay, and then there's just one more thing. Before we end, if you can let me quickly share some ways to protect your Medicare benefits from fraud and errors. Medicare beneficiaries are heavily targeted by scams and frauds, but I'd like to share a few tips on how to keep yourself and your Medicare safe. Okay. Never give your Medicare number to unsolicited callers or visitors. You might get calls during open enrollment. Please don't give them your Medicare number. Medicare will never call asking you for your Medicare number. And then if someone claims to be from Medicare, hang up and call 1-800-Medicare. And that number is 1-800-633-4227. Okay.
Well, great. Thank you for those tips, because we do get quite a bit of calls, so it's good.
I'm doing
It's
a
a good
training,
reminder.
but
Good. So glad.
I'm kind of
All right. Well,
done
thank
with
you
it.
so much for calling today.
I'm kind of ready
Please
to log
feel
out,
free
so
to
I'm
call
gonna.
back if you feel like you need an appointment.
I will definitely do that. Thanks so much for your help. I appreciate it.
You're welcome. Thank you.
All right. Bye-bye.
Bye. Okay, would anyone like to share anything about the counseling session or how they might do things differently?
No, but a quick question. What does tier 1 under hospital and skilled nursing mean?
Yeah, I saw that question in the chat. I'm not technically sure, Chris, so we're gonna Google it when we're done. I think it's standard, like standard care.
Okay, thank you. Just never showed up in the years
I
prior to
know.
this year.
Yep, and I'll be honest with you, I saw that and I was like, what does that mean? But I just never got to that part of I didn't write it down, so I forgot to look it up. And so here we are. All right. So let's talk about fraud and abuse. And you're seeing my screen right now, right? The slideshow?
Yes.
Thank you. All right. Wasn't showing me that you guys were seeing it. That was so you might have heard at the end of the session, we did a little anti-fraud spiel. And so one of the things that Kim is working very hard on as the SMP director for Washington is trying to help us find ways to incorporate fraud into our counseling. You know, give us little elevator pitches and things like that, or things that we can incorporate into a naturally into a counseling session. So one of the things is that at the end of your session, if you can incorporate this, we have a script available for you. It's in the workbook, and then in Appendix C, there's scripts to help you incorporate them into the counseling. But you might have heard on this session, before we end our counseling session, let me quickly share some ways to protect your Medicare benefits. And please feel free to do that, and we encourage you to. And then if you do that, you can do the fraud in areas that you're explaining that about, like maybe benefits, A and B benefits and things like that, or Medicare Advantage. And then you can send to SMP on your BCR. Okay. Sorry. So I have another poll that I'm going to launch. If you can reflect on your counseling. Oh, this isn't the poll. I'm so sorry. During September, what challenges did you face and how did you overcome them? Did you have any challenges in September or since we've started open enrollment that you've had or that you expect to be facing? Maybe questions that you're getting in sessions now. Okay. Lori asked in the chat, what would someone do when they call Medicare? And that there's an anti-fraud script that they have for that too. And then if you do have people who seem to have legitimate fraud, you can have them report it to SMP through SHIBA, and they will take a report and work with them on what the next steps are. When I encourage people to protect their personal information, recognize scam warning signs, review their statements monthly, and report errors or fraud. Okay. Now we have our poll. We'd like you to, answer whether you have a clear understanding of the Medicare changes for 2026. Sorry, I'm having
Is
a
the
problem
poll
with
up? I can't see it.
It's not yet. I'm having a problem with it. Sorry.
Okay.
It's not launching for some reason. There we go. And if you feel better prepared to effectively counsel Medicare beneficiaries during open enrollment. Yes, somewhat, or no. Think of it about 30 more seconds. Okay, I'm going to end it. We haven't had any responses for a little bit. Okay. Well, no one feels worse prepared, so I'm glad for that. And looks like some of you feel more prepared and somewhat. So thank you for that and for responding. Onward. So we're having our lunch and learn on the first Tuesday, or I'm sorry, the first Thursday of November from 11 to noon. We're going to go through the DSNP chart. Hopefully they'll have it done so that we have some time to work with that beforehand, but we're going to go through the 2026 DSNP chart and the information on it and how to modify it a little bit. If people are struggling with that, we'll have just kind of an open session on how to make it look the way that you want it to look. Because right now it's a master chart, but then some of the local places break it down by county. And then some, like what I'm doing, because of someone's brilliant idea in the last Lunch and Learn, is I'm going to break it down by plan eligibility, put all my QMB plans together and all my full benefit plans, my full dual plans together.
That would be
The RT,
so helpful.
I know, right? Yeah, so we'll do that, and I'm gonna show people how to do that in the session a little bit. The RTC office hours for volunteer counselors, we are continuing those through open enrollment. We're actually doing more of them. Right now, you might have, if you put if you put the sessions that we've been having throughout the year on your calendar, please take those off, because we're done with the link that we had for the volunteer counselor office hours. Now we are doing them every other Tuesday from 2 to 3, and the dates are on this slide, or every other Wednesday. So on one week they're on Tuesdays from 2 to 3, and the other weeks they're Wednesdays from 9 to 10. So there's one each week. It just alternates between Tuesday afternoons and Wednesday mornings. And the links are on the training calendar, so you can always find those. And you do need to register for each one individually if you want to attend them. And we have people who come in with questions specific to counseling situations. That's exactly what those are for. And then we have people who come in and lurk and learn. So feel free to do that as well if you'd like to. There are also Medicare counseling and events for the general public for beneficiary that Tim is doing, and those are on the events calendar on the OIC website, on the Medicare information site for the OIC, and the link is also shared in the presentation. And as I said, I'll be sharing that with everyone after. We have a collection of resources for volunteers, and the publications that we're using in the guide to consumer mailings. And as I said, we're still waiting for those Part B premiums and the other information on the deductibles and things like that. The quick reference guide that's posted on our website as a tool will be updated when we receive all that information. So you can have that one sheet with all of the costs on it. Okay, we had a few more questions that I thought I'd get back to. Pam had asked if people who choose a plan during open enrollment would be disenrolled if they are one of those extra help people who get the blue letter. No, they would not be disenrolled for making it. If they made a choice during open enrollment for a plan, they would get the plan that they chose. Okay. When someone does have they believe that they have fraud, they can contact the SMP program. That's Kim McKenna is the director of the SMP for Washington. It's part of SHIBA, and there's a form online that they can fill out, or they can call the 800 number and get a referral, and it will be sent to Kim. So we have those different ways to do it, and sometimes it's just deceptive. It's just deceptive marketing, kind of, or misleading marketing. That's not fraud, unfortunately. And then sometimes it actually is fraud. Okay. Let's see what else. We had a list of we had a question about when people can expect to see the MA plans by county, and Kendra said that it will likely be done and available tomorrow or Monday at the latest. I know they've been working really hard on that, so hopefully we'll have that soon. And then, like I said, we expect to have, we're hoping to have the D-SNPs. Boy, I hope we have it by that first Thursday, right? Otherwise we'll have to postpone that one. That's it. Okay, do we have any questions? I'm going to stop the recording now.